Hello, this is my patient. This is a tracheostomy. I'm gonna go ahead and gather my equipment, perform some hand hygiene, identify the patient name and date of birth, put my equipment on the overbed table. Then I would give some privacy, close the curtains. Then I would assess the need for suctioning. I would ask you to take for long sounds, hear any crackles, ask the patient if he's feeling like he needs suctioning. Then I'll go ahead and verify the order. And then I go ahead and assess for pain. If he's having any pain, I will give pain medications before starting the procedure. Okay. So since he's not having any pain, I'm gonna go ahead and explain the procedure to him. So what we're gonna do, we're gonna suction your secretions to, excuse me, to allow you to breathe better, right? So now we've done that. But before we start the procedure, I need you to, if you're having any respiratory difficulties, just put your hand up like this and I'll know to stop the procedure. All right, thank you. Now we're gonna go ahead and put the bed to my working height. Then I'm gonna put the spiral down. And then since he's a conscious patient, I'm gonna do semi-fallers. If he was unconscious, I would turn him facing me. And yeah, okay. Then I'm gonna go ahead and since he's conscious, semi-faller is gonna place the waterproof pad in his chest. And then I'm gonna go ahead and adjust pressure, adjust suctioning pressure. Right, and since he's an adult male, we're gonna have a pressure of, and it's gonna be a WA unit. We're gonna have a pressure of 150 millimeters mercury. If it was a portable unit, it will be 10 to 15 cm of mercury. I am not sure what cm stands for. We are gonna go ahead and then check for the pressure, suctioning pressure by occluding the port of the suctioning. Okay, we have some pressure, it's good. Now I would make sure that I have my resuscitation bag within reach so I can hyperventilate the patient. Okay, now I'm gonna have my sterile field right here with my sterile stuff. I would open my sterile field. Then I would put the basin just touching the outer corner outside the field. Now I would put some sterile saline. Then I would put on my face mask. I'm just gonna put it right here so I'm able to talk. Okay, so now that I've done that, I'm gonna go ahead and put on sterile gloves. Okay, now I am gonna go ahead and grab I'm gonna use my dominant hand as my sterile hand and this one just as a clean hand. With the dominant one, I'll manipulate the catheter and I'll occlude the white port with my non-dominant. So I'm gonna go ahead and grab the catheter. Okay. And I am gonna grab the connecting tube and plug it in with the, and then this one connected to the suction catheter. Okay, now, okay, this is quite long. Okay, now I would moisten the tip of my catheter. Well, if it was a silicone catheter, I wouldn't have to do this, but I'm gonna check for suctioning pressure. We'll occlude the white port. Okay, then I'll go ahead and hyperventilate the patient or hyperoxygenate the patient by using my resuscitation bag 3 times or 6 times. 1, 2, 3. Okay, then I am gonna go ahead and insert the catheter using my non-dominant hand. with my, I'm not gonna occlude the white port just yet because I'm inserting it. So you don't occlude it once you insert it. Okay, so I'm gonna have my hand here, not including it. I'm gonna insert it up to the desired length. Then I'm gonna go ahead and start occluding the white port intermittently so I can suction intermittently and remove it, right? We don't want to suction more than 10 to 15 seconds. So we're gonna do it fast. And we're gonna withdraw it with rotating motions, right? So I'm occluding it, and then I'm rotating it, and then I'm gonna withdraw it, right? Okay, so I'm gonna wrap it around my hand. I'm gonna put the oxygen, I'm gonna hyperoxygenate the patient again 3 times, 1, 2, 3, and then I'm gonna put the oxygen in, right? This is oxygen. Okay, now I'm gonna assess the patient. I'm gonna ask him how he's feeling, how he tolerated the procedure, and determine if he needs additional suctioning, right? So I would suction a sterile saline to flush the catheter. Oh, sorry. Okay, then I would go ahead and do no more than 3 passes within 1 episode, right? That's my limit. So, and between passes, I'm gonna give the patient 30 seconds to 1 minute for him to rest, deep breathe, and encourage coughing exercises. Okay, and that's it. I'm gonna go ahead and that's the suctioning part. But after I'm done with the trachea, I would go ahead and go into the mouth and suction also the mouth if there's any secretions also, and then I would perform oral hygiene. Okay, after I'm done with that, I would dispose my gloves with the catheter wrapped around my hand like this. Since we're gonna go ahead and also change the dressing, I'm gonna go ahead and remove the soil dressing with my gloves on. Okay, that worked. And then I would dispose my gloves like this. Okay, now you have to wear your face mask like this, but since I'm speaking to the camera, I have to wear it like this, so you're able to hear me better. All right, so we're gonna start with cleaning a tracheostomy, and the first one's gonna be disposable inner cannula. Okay, so first I'm gonna open my sterile package right here. I'm gonna put the sterile plastic cup over here, disposable bag over here, and the sterile con tipped open over here. All right, now I'm gonna put on clean gloves. Okay, and I'm gonna go ahead and remove the inner cannula that's already in place. I'm gonna remove the oxygen. This is oxygen. I'm gonna remove the oxygen, and then this is gonna be the simulated tracheostomy. This is the inner cannula, and this is the outer cannula, right? So it's gonna be like this. So with my non-dominant hand, I'm gonna hold the face plate in place and stabilize at the same time. Then with my dominant hand, I'm gonna go ahead and disconnect with press the locks and disconnect it, the inner cannula, and fast dispose of it. Then switch to my sterile gloves, right? I'm gonna do this fast because he doesn't have an oxygen on. So put on sterile gloves. Okay, my fingers. All right. So now I'm gonna go ahead and same thing. I'm gonna stabilize with my non-dominant hand. I'm gonna stabilize the cannula, and then with my dominant hand, I'm gonna go ahead and place the new one in place like this, and then press, click, and here is the place, and then put the oxygen back into place. That is a disposable one. Now, if we're using a non-disposable inner cannula, we would grab our gloves, or sterile gloves. Okay, make sure we have the 4x4 gauze, the cotton tipped applicator, the brush that we're gonna use to clean the inner cannula, and the new dressing that's gonna be applied. Okay, and the sterile basin that we're gonna be using. All right, so we're gonna pour some, with my non-dominant hand, I'm gonna pour some sterile saline, all right, in both divisions. With my non-dominant hand, I'm gonna go ahead and secure and stabilize the outer cannula. I don't know if you can see. All right, then with my dominant hand, I'm gonna go ahead and press and remove the inner cannula, drop it into one of the basins with sterile water. Go ahead and put the oxygen near I'm doing the process. Okay, now I'm gonna go ahead and pick up the inner cannula and brush it to remove the inner and outer secretions. Now I'm gonna go ahead and apply sterile saline to rinse it, and then I'm gonna go ahead and with my non-dominant hand stabilize the outer cannula and go ahead and place it in place and secure it. Okay, now that it is secure, I'm gonna go ahead and clean the area that's surrounding the stoma, right? So now first we're gonna use the cotton applicators. We're gonna dip it into sterile water, and then I'm gonna use each one to do one swab from the inside towards the outside part, right beneath the stoma. Sorry, to outside, that's one. Dispose of it. Then I use another one, inside to out. All right, dispose of it. Now I would, since it is a little bit wet, I would use the 4x4 sponge gauze to pat it dry. Okay, and I'll dispose of it. And then I would place the new dressing, tracheostomy dressing, underneath the tracheostomy. All right, perfect. Now we're gonna change the tracheostomy holder, and if we had assistants, we would ask them to hold in place the tracheostomy tube. Meanwhile, we'll change the Velcro straps, but now we don't have assistance, so we're gonna go ahead and do it ourselves. And for that, we're gonna put on clean gloves. Okay, now we're gonna keep the old Velcro tie in place so we don't lose the balance of the tracheostomy tube. And we're gonna go ahead and grab the new one and tie it in place, right, along with the old one, right? We're pretending we're tying it to this side, and then we're gonna tie it to this other side. Okay, so I'm just gonna put it right here. The new one is in place, right? Okay, so we have the new one in place. Now that it is in place, we would untie the old one, tie it, and then now we have the new one on. And we would check for the fit. We're gonna put one finger and see if it's too tight. If it's good, then we'll allow the neck to flex, right? So that's what we want. Now we're gonna go ahead and finish, right? This is the only procedure that was left. We're gonna go ahead and dispose gloves. Put on clean ones to reassess the respiratory status, the rate, the effort, the O2 saturation, the lung sounds, and see how effective our intervention was. Now we're gonna go ahead and position the patient to a comfortable position. We're gonna lower the bed to the lowest position. We're gonna pull 3 side rails up, and then we're gonna pull Kava within reach and ask if they need anything else before we leave. If they're good, then we're gonna dispose any other PPE we have, like the mask, and then we're gonna perform hand hygiene, and that's it.